So, for my social issue, I decided to talk about teen pregnancy and how we can help moms after a teen pregnancy and the ways that we can prevent teen pregnancies from occurring. So, some of the first is going to be the overview of the issue itself. So, some statistics would be the rates of teen pregnancy in the US remain far higher than those of most developed countries. Teen birth rate is roughly twice as high among Latina teens and African American teens. In 2017, a total number of around a million babies were born to women aged 15 to 19 years old. Things that contribute to high teen birth rates would include low education and low income levels of a teen's family, few opportunities in a teen's community for positive youth involvement, the teens in child welfare systems who are at an increased risk of teen pregnancy. An example of this would be the teens living in foster care are more than twice as likely to become pregnant than those that are not in the foster care system. So pregnancy and birth are significant contributors to high school dropout rates among girls. Only 50% of teen mothers receive a high school diploma by age 22, whereas 90% of women who do not give birth during adolescence graduate from high school. The children of teen mothers are more likely to have lower school achievement and to drop out of high school. Some ways schools can attempt to address this social issue would be a change in sexual education programs. Currently, sexual education programs that are taught in high schools with hopes of educating students about the danger of sexual activity by informing students of the negative outcomes of sex and teaching abstinence-only sexual practices. This is actually how most Kansas schools teach abstinence in sex ed, and students aren't aware of a lot of the other options that they may have. Abstinence-only programs usually censor information about contraception and condoms for the prevention of sexually transmitted diseases and unintended pregnancies, teaching that sexual expression outside of marriage will have harmful social, psychological, and physical consequences. Abstinence is the only acceptable behavior before marriage. They usually omit controversial topics like abortion, often using fear tactics to promote abstinence and to limit sexual expression. The discussion of condoms is only in terms of failure rates and provides little information on contraceptives. The other kind of program is the comprehensive programs, and in these, students are taught that sexuality is a natural hormone, normal, healthy part of life. Teaches that abstinence from sexual intercourse is the most effective method of preventing unintended pregnancy and sexually transmitted diseases. Teaches that proper use of condoms can greatly reduce but not eliminate the risk of unintended pregnancies and STDs. It teaches that consistent use of modern methods of contraception can greatly reduce a couple's risk for unintended pregnancy, and it allows for the exploration of religious values and how they play an important role in the individual's decision about sexual expression, and teaches that women facing unintended pregnancy have different options. Abstinence-only programs show no positive impact on sexual behavior over time. An evaluation from Arizona and Ohio found that students' attitudes and intentions to use contraception declined with abstinence-only programs, indicating that these programs may have a negative impact on students' willingness to use contraception once they do become sexually active. The Institute of Medicine reported that programs that teach young people about abstinence and contraception demonstrate more success than do abstinence-only programs in delaying sexual activity among youth who have not had sex and at improving contraceptive use among teens when they do become sexually active. Abstinence-only programs leave young people ill-equipped to make responsible decisions about sexual health or to provide informed consent for health services. The U.S. has 11 times the teen birth rate of the Netherlands. How do they keep theirs so low, you may ask? European countries have pragmatic, research-based policies and an open, honest approach to sexual education at school. You might ask, does all of this openness lead to promiscuity? No. European teens in these countries begin having sex at the same time or later than American teens. They have fewer sexual partners and use contraception more consistently than American teens. So my recommendation for current programs would be implementing youth-friendly sexual and reproductive health services, designing designated programs targeted at boys that teach about the correct use of contraception and the importance of being prepared, as well as a program targeted to girls that teaches the same information. By separating the two students, they will feel less awkward about asking questions and more open to discussion with their peers and teachers. The biggest thing that needs to be changed in schools is the general way we teach our students about sex. By using the comprehensive program, we are informing our teens of so much more than just saying no. So as a teen mom finishing school, most teen moms drop out of high school and will never complete their education. Nearly 1 million teens have babies every year, and of these, almost 7 out of 10 will drop out of school before completing high school, and less than 2% will go on to college. 80% of women who have babies when they are teens spend at least part of their life dependent on welfare and have serious disadvantages in achieving financial success and independence in life, largely due to their lack of education. Some obstacles that teen moms face when trying to finish school could be feeling embarrassed or awkward at school, especially if others make them feel out of place, health concerns like postpartum depression, finding childcare. Not all teens have someone that can stay at home and watch a baby, and childcare is very expensive. With a lack of support, teens need that support to finish school as a mom. They need the support from different places like the school system, family, peers, and teachers. Without some kind of adult support, it's very difficult for a teen mom to succeed in school. The need to work becomes an issue because some teen moms are put in a position to support themselves as well as their baby, which can interfere with school. This goes back to childcare being really expensive and teen moms having to find a way to be able to go to school and somebody watch their baby at the same time. Being behind in school is a big problem. Teen moms are often already behind in school after pregnancy and childbirth and may feel overwhelmed trying to finish. Providing options to support the teen in proceeding with her education is a big issue and something that needs to be addressed, especially if you're trying to get the teen mom to finish school and become productive and successful for herself and her baby. Some ways that we can support the teen mom and provide her with options would be providing a daycare center in school, which could possibly tie into early childhood development classes. I know there's a few of the high schools in Wichita that actually have one of these programs that allows some of the students to actually work in the daycare center and the moms to be able to bring their children to school and not have to worry about a child care service during the day. GED programs to help moms who are behind graduate, night school, community college, and an online education are all some ways that a teen mom can succeed in school. Other ways to support teen moms and encourage them would be to provide realistic expectations of motherhood, inform them of challenges and rewards. We could provide them with classes that teach them about handling the responsibilities of motherhood and adulthood, including managing money, finding a job, and child rearing. A supportive adult who will help guide the teen through the challenges of finishing school, finishing school as a mom, and keep her focused on her goals, which pushing her to become successful in whatever way she wanted to before having a child. Proper resources to take care of her child, like providing her with the time and place to pump if she's breastfeeding, and providing her with the information on programs that allow you to rent breast pumps and any general information that would help and benefit her, and support groups for pregnant teens. We could have some programs designed to help prevent the teen from dropping out of school. These would include the social worker as well as the school, and sometimes people outside of the school, like parents or peers. So some of these could be collaboration with outside community organizations, on-site healthcare and childcare services, counseling and mentoring, off and on-site group therapy sessions, academic support services and career preparation, case management services, and support for moms, especially those that have been rejected by family and peers. Some things to consider implementing in more high schools would be programs that address attendance-related problems, which this is actually exact what one school did, and they said they were a school-based social worker performed a valuable role in determining the reasons for non-medical absences and improving attendance by addressing outside barriers to school attendance. Once all factors contributing to poor attendance are identified, the social worker can collaborate with relevant staff and outside resources to solve problems the teen mother is facing. For example, absences related to lack of medical care can be addressed by school health clinics providing prenatal care and classes on important or good prenatal care. According to Cambry, Ellis, and McCoy, Simpson Academy recently added an on-site health clinic in partnership with Rush University Medical Center. So their attendance raised significantly because of these add-ons, which meant that more teens were at school, which is especially great considering of the rates beforehand. So overall, providing more programs that become readily accessible for every teen mom in every school would allow for statistics of graduation and college attendance to rise, meaning dropout rates become drastically lower by offering moms the support they need and the extra push to become what they have always dreamed of becoming, as well as being a good mom. Some of the sources I used, all of the sources I used were the CDC, the AMA Journal of Ethics, socialworktoday.com, and teen pregnancy statistics.